John Popovich here again in the beautiful atrium of Henry Ford Hospital in front of the living wall. As we continue our Legends interview series. Really pleased today to have Dr. Lisa Newman, who's the director of the Breast Oncology Program here within the Henry Ford Cancer Institute. Lisa, welcome to the Doc and the D interviews.
Thank you. Great to be here, Dr. Popovich.
Describe for me what really is the breadth of your program. Who participates within your program, and what are the types of services that you provide?
Well, we describe our breast oncology program as a key element being the multidisciplinary nature of it. And it's multidisciplinary in terms of the clinical care that's provided, and most importantly in terms of the planning and the education of the patient that's provided. One of the most exciting advances that we've made in breast cancer over the past several decades, and we've made many, but one of the most exciting advances is the recognition that breast cancer is actually a whole spectrum of different disease types, and each type has a different treatment strategy that has to include multiple different fields of expertise.
You also have been very significantly involved in dealing with healthcare disparities. I wonder if you could describe what your work has been and how that actually relates to the work that you do within breast cancer.
So one of the reasons why working in the Henry Ford health system is so very, very exciting is because of the robustly diverse patient population that we care for. And that includes diversity related to racial ethnic identity, as well as culture, religion, lifestyle. And we are able to identify ways that breast cancer can affect patients of these different backgrounds in unique ways. My research for a long time has involved looking at the association between African ancestry and breast cancer risk. And one of the things that we've learned is that African ancestry is associated with the higher likelihood of being diagnosed with breast cancer at younger ages and a greater likelihood of being diagnosed with a biologically more aggressive pattern of breast cancer, a pattern that we refer to as triple-negative breast cancer.
And I would imagine what we can offer patients within communities dispersed through southeastern Michigan and elsewhere is that we can avail those physicians and those patients will have opportunity to have interaction with people such as yourself or your team in the tumor boards and some of the novel concepts such as the molecular tumor board.
Exactly. And one thing that distinguishes us from a lot of other programs is the fact that we so wholeheartedly believe in all of the docs from the different specialties being together, sitting together as we evaluate each newly diagnosed breast cancer patient and reevaluating these patients as a team through the continuum of each patient's care.
What's the future of breast cancer care?
Our colleagues in breast cancer and breast oncology have really been on the forefront of this aspect of medicine that we refer to as precision medicine, where we work very diligently to understand the genetic machinery of each cancer and then try to tailor the treatments to the genetic machinery of that breast cancer. We have a long way to go. We have some very basic markers or basic signatures that we deal with now, but we have indeed developed precision strategies that are very effective at treating those particular signatures that we've developed. And as we go further, we will have a broader armamentarium of strategies effective at treating discrete subtypes.
Well, Lisa, I just want to thank you. Your coming over to Henry Ford and establishing the program has been really one of the really pathfinder programs for the Henry Ford Cancer Institute.
It's been such an honor to work here.
Thank you.